So who's a candidate for a lower blepharoplasty versus under-eye filler? Typically this requires a consultation or at least some pictures to take a look. If you're interested in a more permanent result, then lower blepharoplasty is by far and away better than getting under-eye fillers. Under-eye fillers need to be repeated at least once a year, sometimes every other year. With a lower blepharoplasty, we also have a lot of freedom if you have loose skin underneath your eyelids. In addition, if your bags are pretty significant, adding a bunch of under-eye filler will only make you look puffy. So the people who are best candidates for a lower blepharoplasty are people who have deep hollows under their eyes, if they have pretty significant bags, or they have loose skin. And finally, as we discussed, if you're interested in a permanent result, then surgery is the only option. My surgical approach to the lower eyelid is a little unique. I incorporate removal of fat as well as fat transfer to create a natural looking result. Through a small incision inside the eyelid, I remove the eye bags. There's usually a hollow left over, so I take a little bit of fat from the belly and layer it within that hollow to create a nice smooth contour. With that fat transfer, I can place a little bit into the outer cheek, which also helps tighten the skin. And finally, if your skin is loose, a CO2 laser can be used to resurface it and tighten it. Recovery just involves some mild swelling and bruising, but not much discomfort or pain. We'll give you some eye drops and some pain medications, and the recovery takes about 2 weeks. Now I can see how it can be very confusing because I'm talking about removing some fat as well as adding some fat. Think of a lower blepharoplasty with fat transfer as mountains and valleys. You have a mountain of fat that's causing the eye bag and a valley that's below that's causing the hollow. With surgery, I can lower the height of the mountain and add fat to raise the height of the valley, and now they become even. And with that evenness, you won't be able to tell where the lower eyelid ends and the cheek begins. That gives you a natural and nice looking result. Contrast that with filler, again, the mountain and the valley. And with filler, you can only fill the valley up to hopefully meet the mountain. That's why people can look overfilled by using under-eye filler. So with lower blepharoplasty, you can see how you have a lot more control to get the best possible result.